Melasma, understanding dark spots on the face. What causes melasma? There are several why melasma occurs. Sun exposure. The sun's ultraviolet, UV, rays play a primary role in all types of hyperpigmentation, including melasma. UV rays, as well as visible light and heat, activate melanocytes to make more melanin. Tanning beds. Using tanning beds exposes you to artificial UV rays that are stronger than the sun's UV rays. Pregnancy. The hormone component sets melasma apart from other types of hyperpigmentation. More specifically, estrogen and progesterone are the culprits. Those hormones rise during pregnancy. Similarly, birth control pills and hormone replacement therapies can also trigger melasma. Certain medicines, like pregnancy, birth control pills and hormone replacement therapies, can trigger melasma by increasing estrogen and progesterone. Some retinoids, antibiotics, and blood pressure medicines make your skin sensitive to the sun's UV rays. In addition, certain anti-seizure drugs may trigger melasma. Stress. In some cases, stress triggers melasma by increasing cortisol levels. Thyroid dysfunction. Typically, your thyroid makes hormones that regulate your metabolism and heart rate. An underactive or overactive thyroid may trigger melasma. Treatments for melasma. With melasma, treatment goals include reducing melanin production and evening out your skin tone. The time it takes to achieve those goals varies. However, you may see results within 3 to 12 months. Sun protection. Wear a water-resistant, broad-spectrum sunscreen with an SPF of 30 or more daily. Specifically, sunscreens with zinc oxide, titanium dioxide, and iron oxide help with melasma. Sun protection can help reduce the appearance of and prevent melasma. Medicines. Hydroquinone helps even out your skin tone. A healthcare provider may also recommend tretinoin and a mild corticosteroid. In some cases, they may advise using a cream that consists of all three ingredients. Other medicines include oxalic acid, COC acid, and vitamin C. Chemical peels. These lift off some of the surface pigment. Microneedling. This increases the absorption and efficacy of topical medicines. Lasers. Using heat. This treatment targets and breaks up pigment, though heat can also trigger melasma. Therefore, lasers that don't generate too much heat are key to treating the condition. Platelet-rich plasma. A healthcare provider injects your blood plasma into the affected area with this procedure. Tranexamic acid. For severe cases of melasma, a healthcare provider may advise using tranexamic acid. This medicine is available as a topical or oral solution. Additionally, you can conceal melasma with makeup. A healthcare provider may advise first applying your medicine, then sunscreen. Lastly, apply any makeup to conceal the affected area. How to prevent melasma? You cannot modify some risk factors, like family history or natural skin tone. However, one risk factor that you can control is sun exposure. Protecting yourself from the sun's UV rays is one of the best ways to prevent melasma. So, use a water-resistant, broad-spectrum sunscreen with SPF 30 or more daily, reapplying at least every 2 hours in the sun. Also, wear broad-rimmed hats, seek shade, and avoid the sun as much as possible. Not using tanning beds is key. Comorbid conditions. Melasma may increase the risk of or concur with certain health conditions. Hormone imbalance. High estrogen and progesterone levels increase the risk of melasma. People who are pregnant, taking birth control pills, or undergoing hormone therapy during menopause have a higher risk of melasma than others. 7 For example, pregnancy accounts for as many as 56% of melasma cases. Anxiety. Research has found that anxiety rates are high among people with skin conditions. In fact, about 11.6% of people with melasma have anxiety. Depression. Besides anxiety, some evidence suggests that melasma affects self-esteem, causing depression symptoms. Living with melasma. Melasma is not a fatal, or even harmful, condition. Researchers have not found any malignant cases of melasma. In fact, some evidence suggests that melasma might lower the risk of melanoma, a severe type of skin cancer. Keep in mind that it may take time for melasma to reduce after stopping hormone medicines or giving birth. Also, melasma may return if you start taking those medicines or get pregnant again. All in all, one of the best ways to minimize melasma is to lower sun exposure. Research has found that avoiding the sun's UV rays can help reduce the appearance of melasma and prevent it from returning.